so we really were the leaders. We did make some huge changes to the way we interact with people who need to be discharged from hospital, break down a lot of barriers between ourselves and the trusts, and also with the CCG, and it meant us working closer with the CCG than we probably ever have. I try to inspire people, sometimes from the middle, try to mentor them, try to move them towards a goal, make sure that they understand that I have a vision and a strong vision of how we get to where we're going. So it's about that integrity, so that people don't think you're simply saying things that they want to hear, or they're saying things to you that you want to hear. I think when people talk to me about what we're doing, about my leadership, they know that I will listen, they know that I will change and adapt. And it's real, and that's probably the biggest asset as a leader we have, is that ability to take people forward and carry people forward and establish that honesty, which I think is really, really vital for good leadership.
PSS is a health and social care charity and social enterprise based here in Liverpool, but actually working in a number of regions in the UK in terms of what we do. So as I say, it's health and social care, so an awful lot of work around adult social care, and working also in the criminal justice sector, particularly around women's criminal justice. So we talk to people who work in the organisation, we talk to people who use our services, we talk to people who commission our services, and we really listened to what they had to say. And so when we were then presenting the big plan back to people, they could see that they'd really been heard, and some of their ideas were absolutely included in that. And I think that that's the best way to do leadership, is, as I say, really with people. Actually, you get something much richer by listening to people from right across the organisation. And so I think we have to be really creative. I think that we have to be very forward thinking. I think we have to help people to be as resilient as they can be. But I think it's also important that we speak up when things aren't right, because actually there are some people that do need support from society, and that's what's having that safety net, that welfare state. So many of the ideas that form our welfare state now came from PSS back in the 1920s and the 30s, and it's really important that actually we also speak out as an organisation, but also as a sector, for society's most vulnerable, and make sure that their voice is heard.
Other sectors are probably moving a little bit faster than health services in terms of how we access information using phones, mobile phones. So I'm really looking forward to the NHS pushing forward with the use of data and technology and all that new information that brings into teams like mine, and we can synthesise that information with other forms of intelligence. There's a lot of research and evaluation of evidence and things like that to understand current services, current service provision, match that against the demographics of the population and what the characteristics are, and they differ from place to place. The NHS thrives and survives on goodwill of people who don't walk away when it turns 5 o'clock because they need to go. You know, it just survives on people helping each other out and supporting each other, and you only get that where there's a sense of team and a common goal or common purpose, which I think the NHS has. I do consider myself to be a team leader, and I think those qualities are visible. You see them all the time in your colleagues. You don't have to be in a position, particular leadership or management position, to display leadership qualities. You can display them at any point. And actually, if you look around yourself and see a gap in leadership, then step up and take hold of it and have a go.